Hello, I'm Neil Frood. I'm a clinical psychologist, and I want to talk about a strategy for delivering mental health help to people who have mild to moderate mental health difficulties. There's a story behind how this strategy developed here in Wales. It goes back to 2003 when, as a clinical psychologist, I started working again clinically in the health service and found that the very effective psychological therapies that had been developed over the years, just because of resource issues, couldn't be given to lots of people. They couldn't be delivered to lots of people. And I thought there must be a way of getting this very powerful therapy out to many more people than just the few who were able to benefit from one-to-one therapy with a psychologist or a counsellor. And it struck me that there are books which translate effective psychological therapy, particularly something called cognitive behavior therapy. Right? There are books that actually translate that into a self-help step-by-step guide so that people can follow those books in order to address their emotions just as they might follow a recipe book for cooking or a do-it-yourself manual. So it seemed to me that there were these powerful books. There's no shortage of books, very powerful, effective books written by experts with decades of clinical experience and lots of research. So how could that effective therapy be delivered to a vast audience, or at least to a lot of people who could benefit from that? And it struck me that one way to do this would be to actually inform physicians, GPs, about what were the really best books around for various problems, and to then provide these books in public libraries so that the GP could actually write a prescription for one of the recommended books. And then the patient, the client, could take that prescription just as they would take a prescription for medication to their pharmacist, so they would take the prescription for the book to the local library and they would get out this very powerful book, which would give them at least a good chance of helping with their emotional problems. It seemed to me that this was such a low-cost alternative that there must be some flaw in what seemed to be a very simple idea that could be very powerful, because we were talking about something that costs very little, that could be very effective, and so therefore the cost effectiveness would be very, very high indeed. Well, I thought there must be a flaw because this is a simple solution. Surely there's got to be some catch in it and so on. Well, I started in Cardiff in Wales and we had a citywide scheme that did just that, and it worked. People were using it, people got a lot of benefit from it, people were telling us that it had really helped them and so on. And so much so that just within 2 years the government in Wales had said, let's make this a national scheme. And so that was the launch in 2005 of Book Prescription Wales. And since that time, it's been in constant use. The number of books that are borrowed from libraries from the list, the revised list, is in the order of 30,000 a year. So a lot of people are benefiting. Wales has a population of about 4 million, so it's a large number for such a small country. There's a great deal of enthusiasm, and indeed so much so that, of course, it's been now taken up by other countries, by other areas, have actually seen that this is a very effective and cost-effective, particularly, way of actually delivering therapy. Because we do think of psychological therapy as being one-to-one. There's a therapist live there in the room with one client, and for an hour over maybe 12 sessions or so that you have therapy, sometimes indeed hundreds of sessions. But what we do know is that for many people, not for everybody, but for many people, it is sufficient to actually have what is called bibliotherapy. Bibliotherapy, therapy by the book. That's therapy which is delivered self-help wise. And a lot of people get a great deal of benefit from that. They learn about their their condition, whether it's depression, whether it's obsessions, whether it's anxiety, social anxiety, health anxiety, panic attack, and so on. So we're talking here about the mild to moderate level of mental illness. We're talking about, in fact, that's the vast majority of people, because of all people with a mental health issue or problem, and that, by the way, that number is absolutely huge. More time of disability is the result of depression than any other single illness, be it a mental illness or a physical illness. Okay, that's according to the World Health Organization. So depression alone is a huge issue. It's very, very common and getting more frequent and more common. And anxiety too, so that at any one time, and these are the official figures, at any one time, in the adult population, 1 in 6 people has a diagnosable mental illness. Whether or not they're actually diagnosed depends on whether they've come to their GP and so on. But actually 1 in 6 of the population at any one time. In a lifetime, it's 1 in 4. Some estimates actually put it at 1 in 3. So we're talking about a vast number of people, far more vast than could actually be catered for in terms of psychological therapy by a one-to-one treatment. But fortunately, certain forms of psychological therapy, and in particular this cognitive behavior therapy, is actually very robust, that you can deliver it by all sorts of means, and it doesn't seem to lose effectiveness. That is, you can deliver it over the internet, you can deliver it by DVD, you can deliver it by the book. Of course, there are limitations, and one of the limitations is that not everybody is going to take to the idea of bibliotherapy. There are some people, for example, who are going to have difficulty reading at the required level. There are going to be some people who just really can't get engaged with a book. There are other people who have sensory deficits and they can't read the book simply because their sensory problems prevent them from doing that. So what we're talking about here is a scheme that's a sort of off-the-peg therapy. And just like off-the-peg clothing, it's very useful and most people can be catered for by it, but sometimes you need individual tailoring. Now, what the book prescription strategy does is to provide an alternative or an additional form of therapy for a lot of people, some of whom will benefit enough that they don't need any other treatment. And that will leave, therefore, professionals' time for those people who can't be, as it were, fitted off the peg, but who need that individual, and of course also people with serious mental illness conditions. And you certainly wouldn't just give them a book and say, get on with it. So as a step towards helping this vast number of people, because the alternative, and what the physician has been faced with up to now, is that there are very limited resources, nothing that I can signpost you to, or very little if you have a mild or moderate. If you have serious mental illness, of course, then there are specialist services. But without that, very often, there seems to be nothing that I can offer you as a GP. Whereas, of course, writing a prescription for medication, antidepressant medication, anti-anxiety medication, that's very simple. That can be done very simply. But people actually prefer, and let me say that psychological therapies for mild to moderate mental health conditions, psychological therapies and pharmacological medication therapies are about equally effective. Both are effective. When surveys have been done, it's quite clear that a lot of people, not everybody, but a lot of people actually prefer the psychological approach. Very often they recognise that their emotional problems are the result of life events, things that have happened to them, disappointments, what they see as failure, things like that. And they can't really see that the solution, the best solution to their problem, to that problem, is actually a pill, a blue pill or a green pill or whatever. They sort of feel that the need to actually understand themselves is something that would actually help more than that. Now, the history of this then is that having come out of a university career back into clinical work, I was really struck by the fact that so much of what was effective was just unavailable to people, to the vast majority of people. There must be a way of getting that therapy through to many, many more people. That was the incentive for this very simple paperclip idea of the book prescription strategy. I thought it's so simple that there's got to be a flaw. As far as I can see, there isn't a flaw, and it's now, we're 10 years down the line. And this has been rolled out nationally in Wales. It's been also, of course, now emulated in many countries of the world. And just in this year, 2013, the England scheme, which had been sort of a bit patchy, but had been very much in England, actually came together as a national scheme. So there is now a national book prescription scheme in England, but it's also used in many other countries, in Scotland, in Denmark, in Ireland, New Zealand, and so on, because it's such a cost-effective idea which provides people with an additional way of trying to address their emotional needs. And there are so many people who have the need for therapy that bibliotherapy is one of the routes to that. And let me say that, of course, it's not that any self-help book is effective. There is the notion of quality, that some are high-quality books. If you were to search for just self-help books, you will find everything from the wonderful to the ridiculous and to the dangerous, maybe. Okay, so what is clearly needed here is the advice and the selection by mental health professionals, and that's how we've done this. That when we come up with our list of just 30 books out of the 150,000, if you look in, one of the large online book retailers, you will just put in self-help and so on, or self-help and depression, and you'll see that there are thousands of books. Some of them are excellent, and some of them are not good. And so what you need then, and this is what this scheme does, is to actually have people who know the books, who know the approach, to actually select the creme de la creme, the books that are really powerful, the books that are really effective, and to put those together into a list which can then be used by health professionals who are not experts necessarily in mental health, but they can be confident that the books on this list are all good books that will help many people. So that's the simple, very simple approach, using the public library system, using GPs, using books that are already written. And one of the beauties of this scheme and this strategy is that it uses resources that are already there. We don't need to build libraries. The libraries are already there. We don't need to write the books are already there. All we need to do is to join up things that are already there and have been there for many, many years. It needs very little, it needs a little bit of guidance, but not any specialist training for the GPs who use this. The book prescriber, because that's what we do, we actually go with that medical model of prescription. We actually say we are prescribing a book, and there's a pad, and you prescribe which book for how many weeks, and the library accepts that, and the library gives you the book, and then you go away and you work through the book. And sometimes you'll come back and you'll say, I want another book just like that, and the librarian will guide you. And the librarian, just like a pharmacist, of course, is somebody who can help, somebody who's bound by ethics of confidentiality, and so on. So this scheme, over its 10 years in Wales, but beyond Wales now, has helped a lot of people. We know there's been the research, we've asked people, what did this do for you? And we know that a lot of people have been helped. This is something that costs very little. It is very effective. And that means when you put those two things together, high effectiveness and low cost, this is something which is highly cost effective. And it's an idea. So in a sense, I am selling something here, but we're giving it away. It's an idea which can be emulated around the world. It's an idea which is, it makes a lot of sense, and I hope that I persuaded you that that actually is a good idea, the use of the book prescription strategy for mild to moderate mental health.